problem. Thank you, everybody, for joining us this evening. We have Michele, our dietitian, here with us to talk about some nutritional stuff for pancreas cancer. But she already has her slides up and her audio is good to go. So, Michele, you can go ahead whenever you're ready. Thank you for joining us this evening. I think you're muted again. Can anybody else hear her? Or is it just me?
Yes,
There
sorry,
you go.
I muted just so background. Okay.
You're good now.
Okay, yes, I'll regroup. Thank you all for attending as well. I see there's a number of people who are here, which is just wonderful. Hopefully this will give you some insight and information to nutrition with pancreas cancer. I'll keep my video up just for a little bit and then I'll turn it off for while I'm talking so we can focus on the slides. But to introduce myself, my name is Michele Derdzinski. I am one of the clinical dietitians with the Frater Cancer Center, and I'm specialized with the pancreatic cancer program. So I work with the medical oncologists while people are going through chemo. I work with the radiation oncologists while people are going through radiation. And then I work with our surgical oncologists as well for people that do have any of the pancreatic surgeries. So as a little background, I see there was a question about the difference between a nutritionist and a dietitian. So everybody here who works at Frater or a hospital setting is a dietitian. So we go through an exam, which gives us our registered dietitian, and now dietitians need master's degrees as well. But basically there's that certification versus a nutritionist doesn't necessarily have to have the same specific training, and so they couldn't work in a hospital-based employer, basically. So I've been here at Frater for about 10 years. I've been a dietitian for maybe 7 of those. I started out in the inpatient setting, going through all the different hospital units, and spent a lot of time on 12 CFAC, which is where a lot of our pancreatic cancer surgery patients are, and really grew interested in working further with people with cancer and then pancreatic cancer. So I came over here during the pandemic. I think it was May of 2020, and I've been here ever since. That's a little bit about me. Let me just, okay. So today, we are going to review the general role of nutrition with pancreatic cancer treatment. I want to give you all nice broad overviews, understanding the major functions of the pancreas and how that impacts your nutrition. Common nutrition-related side effects associated with pancreatic disease, mainly pancreatic cancer, and then the different support symptoms associated. And then just a really brief overview on extra topics that you might hear when you go online or in message boards and things like that. But at the end, if you have more questions, I know there's a lot online about nutrition with cancer and with pancreatic cancer, so we can get into any other questions you have too at the end. So the role of nutrition, there is with pancreatic cancer, a relatively high risk for nutrition issues. This can start before somebody's diagnosed. This could be with chemotherapy, radiation, surgery, really any of those points with the treatment process. And a lot of that has to do with the location and the function of the pancreas. So all of us, our pancreas is located behind the stomach and surrounded by the small intestine, spleen, gallbladder, and liver. And it has three parts: the head, the body, and the tail. And so somebody's tumor could be in any of those places. And then if somebody is getting surgery, they determine the type of surgery according to where that tumor is. The different side effects that people experience could have to do with the functions of the pancreas too. So our pancreas, which we'll get into more, has a function of creating pancreatic enzymes with help with digesting fat. And then it also helps with producing insulin, which has to do more with carbohydrates. So a lot of nutrition impact. And then the treatment as well, which we'll get into more later, can also, of course, have side effects that impact nutrition. It can affect people's appetite, which can lead to weight loss and reduce strength. And it can have other side effects like diarrhea and taste changes and such. So all of that is basically why there are dietitian services at the Froedtert Cancer for pancreatic cancer patients. If you are looking to work with a dietitian but have not yet, the different things that we do. So we can help provide recommendations for optimizing your nutrition based on any nutrition related side effects like diarrhea, nausea, taste changes, etc. Someone's having unintended weight loss, we can talk through tips for that. We can help start and adjust pancreatic enzymes. That would be something like Creon or Zenpep are the brands. We'll go through that more. Important to know for you or family or anybody, it is a free service for patients. It's not billed at all. And then either a patient can request to see a dietitian or the provider could recommend that you do work with a dietitian. Based on you and your appointment with the dietitian, it could be a one-time thing if that kind of met your needs, or it could be some long-term counseling. And we definitely, for people going through radiation and surgery, automatically see people at this point through all of those phases. So we also tend to meet you wherever you are. So it generally isn't too big of an add-on for patients time-wise. So we might come up to the day hospital while you're receiving chemotherapy. We might take it on to the radiation doctor visit, just come right up to the third floor and see you there. Might see you before your surgeon's visit so that it's less of an inconvenience in theory. Great. So now getting into, just want to check the chat. The exocrine function, which is going to be our fat absorption. This is one of the main functions of the pancreas that impacts our nutrition. So basically what happens for all of us with all of our pancreases, our pancreas can sense when we eat. So we eat a meal and the pancreas releases these pancreatic enzymes into our GI tract as we eat. And it knows how much to release based on how big the meal is and specifically how much fat's in the meal, because mainly it's acting to digest fat. So then it releases these enzymes into the GI tract so that as the food's moving through the gut, it's acting on the food to digest the fat. So for somebody with pancreatic exocrine insufficiency, which you also might see online as called EPI for short, exocrine pancreatic insufficiency, the symptoms, well, what's going on is that the pancreas is not releasing as many enzymes as it should into the gut. So then some of that fat is moving through undigested, and the symptoms are on the screen. So cramping after the meals, indigestion, a lot of gas, might be a smelly bowel movement, bowel movements that are floating or greasy, loose, and it may be frequent. So we say 2 or more times a day. So that is why if you are in an appointment and you're wondering, oh, why is this person asking me 5, 6 questions about my bowel movements, whether it be a doctor or a dietitian, generally speaking, this is why. This is really important because if we can have you then prescribed these pancreatic enzymes by mouth, then that'll help you to digest your food properly, then optimize your nutrition, and most importantly, feel better. Okay, so who might need these pancreatic enzymes? You can see on the left panel, it could be before surgery, and then pretty high percentage of people who get a pancreas surgery end up needing these enzymes. The common brands are on the left side. New this year, it was positive. Zenpep now has a higher dose, which is 60,000, and Pancreas came out with a higher dose. This is a positive thing for people that need a higher dose of, or sorry, a lot of capsules of a lower dose. So basically, these brands all come in different dosages. And let me try to actually show you a little pocket card that I have to explain it better. Um, Video on. So, so these are all the different brands, and it's kind of, I describe it, the difference between Coke and Pepsi. It's just truly different companies. So you can see that there's Zenpep 3000, and there's Creon 3 and 6000. Those are generally more pediatric brands, although occasionally a doctor will prescribe that for a patient. The dosages we more prescribe are going to be 12,000 or 24,000 unit of the Creon. And that Creon is the brand the hospital carries. It doesn't matter what brand you're on as long as your insurance covers it or you can get it through an assistance program. But all this is getting at is that the amount of capsules, or sorry, the amount of enzymes are higher as you go to the higher dosage. So that 36,000 is simply indicating how many units of the actual enzyme are in the capsule. Hopefully that makes sense. So we prescribe the dosage and then the amount of capsules based on your bowel movements. So the reason for that is because if somebody is more constipated, the side effect of taking too many enzymes is constipation. So we don't want to overload you right when we prescribe it. So we would start somebody who's more baseline constipated with a low dose if they're just showing a little bit of these signs of insufficiency. But if somebody comes to us, say, having 6, 7 bowel movements a day, they're floating, they're tan, they're greasy, clearly this pancreas insufficiency, we would start them right away on a higher dose so that they're not taking 4 or 5 capsules of the lower dose. This is not a medication that's like, it's very different from, say, a blood pressure medication where your doctor might just say, take one of these in the morning. Unfortunately, it's a bit more labor intensive and a bit more dynamic than that. So you need to have a good understanding of why you're taking it and then how to know if you need enough. Because we may, for example, say to somebody, start by taking 1 capsule of Zenpep 25,000 with each meal. But maybe they'll still have those signs of insufficiency a few days later or a week later after they started the medication. That's just saying to us that they need to take more until their bowels are more normalized. But then the other thing here is that there's other tips to help them. So dividing the capsules, or I call it staggering them throughout the meal, meaning taking the first one with the first bites, the second one midway through, and so on, can be really helpful for people because that's better mimicking what the pancreas is supposed to do. Another tactic that some people find helps them to see the impact of the enzymes better is to open up the capsule onto applesauce. So I can show you an example on my video of what I mean. Well, this is the bottle. I had a picture of it. This is Zenpep. Again, just it doesn't matter what the brand is from our standpoint, but you can see how this is the capsule. So you can open this up and then you can just sprinkle it onto applesauce. There's only a couple foods that it should be sprinkled on. Although you may see a few different things online, but what we generally recommend to people, something like applesauce, because it's the perfect environment where it just stays dormant until it reaches your body. Because otherwise, if you put it, say, in ice cream, it can start acting on the ice cream and it'll do less than in the actual intestines. But, anyways, not having to digest the capsule for people with really bad diarrhea is sometimes impactful. Those are the biggest ones. You can see all the other ones on here too that I won't go through one by one. Those first two I find are the most helpful. So how many do you need? I already touched on that briefly, but it's very different person to person. So again, somebody who comes to us with fairly normal bowel movements, but maybe they're tan and floating, we would start them on a lower dose so that they don't get constipated. But someone with really bad diarrhea, we'll start them on a higher dose to try to really help their bowels to improve. Sometimes one person tolerates a different brand better than another. That's not the majority of people, but we do see that sometimes. And there are some base calculations that you can find online to help. We really try to tailor and individualize this based on symptoms for our patients. Okay. So that is the exocrine function. If you have any questions on that, besides what I covered, you can definitely ask at the end, or you can always contact me. My contact will be at the end of this. So then we get into the endocrine function, which is what more people in society, I would say, know the pancreas for. So the pancreas produces insulin. That's what we call the endocrine function. And that helps to maintain our blood sugar control. So similar to pancreatic enzymes, sometimes people need medication agents to help them control their blood sugar. If they're having blood sugar issues anywhere from before diagnosis to after surgery. Same thing with the enzymes. It can happen at any point in your pancreatic experience. So blood sugar control is really important, as I'm sure some of you, or perhaps many of you know, a low blood sugar can lead to symptoms like sweating and dizziness, and it certainly can have long-term effects as well. At Freighter, if a patient gets surgery, we have a diabetes team that follows them every day of their surgical stay. And they will monitor the blood sugars and let the person know if they do need to go home with some insulin or with something else for blood sugar control. And anybody else who's not getting surgery on insulin too, who is on insulin, they can help with managing the blood sugars if needed. Sometimes people will have their local doctors help otherwise too. So that's the endocrine function. Again, more so managed by our endocrinology team than, say, the dietitian team, but obviously it's just a big part of people's journeys sometimes. So it's definitely worth mentioning as far as nutrition impact with pancreatic cancer. So next part here, general nutrition related challenges. This is really common, again, at any point from before diagnosis to after surgery. So the most common ones I would say would be loss of appetite, unintended weight loss, meaning you're not trying to lose weight, but you do, and it's sometimes unexplained. Taste changes, that's most common with chemotherapy, and then an array of GI issues. The other thing to note is that these challenges likely will evolve through different phases of treatment. For example, again, chemotherapy, taste changes is really common. Nausea, very common as well. Radiation and surgery, diarrhea is pretty common there. So we make recommendations based on what's going on at that time. So in chemotherapy, we may tell you some tactics for the taste changes. And then during radiation, tactics for the diarrhea. This can get really confusing because at maybe 1 month we're saying to you to eat one type of food, and then all of a sudden with the diarrhea, we're saying, oh, no, don't eat that, because it basically just depends on what your side effects are. We'll go through some of these in a little more depth. So that first nutrition side effect that I talked about is that loss of appetite and unintended weight loss. Um, it's really challenging, again, as I'm sure some of you have or are going through when this comes up before you're even diagnosed, because then you go through chemotherapy, which often can be challenging. That is where doing some meal planning can really be beneficial, so that you wake up and kind of have a plan for the day already, because it can be really easy in the lack of hunger cues for it to be all of a sudden maybe 2, 3 o'clock and oh no, I haven't eaten anything today because my body hasn't told me I'm not hungry. That's very normal with treatment to have your body miss those hunger cues. So instead, some people actually set an alarm for every 2 to 3 hours as a reminder, I should eat something. And it's not because I necessarily want to. Unfortunately, it may be more so. This is part of my treatment process. I know that the nutrition's important. And the reason that this is all important is the little blue box at the bottom. Weight stabilization, muscle mass, and strength is associated with improved survival, quality of life, and improved surgical outcomes as well. If eating something solid is really difficult, which it often can be, then doing calorie containing fluids can be a great option. And I'll show you some of these examples at a later slide. And then I have some samples in my office here too. But that can be things like Ensures or Boost, or you could make your own shake with like nut butters or some milk or ice cream and that type of thing, depending on what suits you best. And then really honing in on what it is when you are doing solid foods, what's on your plate. So you want to focus on whatever is high calorie and high protein, because that's essentially giving you the most bang for your buck. So it would make more sense to give yourself peanut butter, and focus on like a peanut butter toast rather than maybe a cup of watermelon. The watermelon is certainly nutritious and good at different points in our life, but if the biggest goal is stabilizing your weight and your strength, the nuts, the nut butters, that type of thing, fish, dairy, those are going to give you more calorie content and have more of an impact. Someone really continues to struggle despite trying to meal plan, trying all sorts of different options. Appetite stimulants could be an option. That would be a discussion with your doctor, as that's who would prescribe those. And it can sometimes depend on if it's appropriate with your medical history and your current medications. But those are another medication you could take. So this slide is showing some of these different oral nutrition supplements. So that's when I was talking about, quote, drinking your calories. We have a lot of nice recipes if you wanted to do a homemade option, which I know some people find to be more palatable and appealing. But I want to show you some of the ones I'm just at the Wauwatosa campus, but we do have a dietitian at Drexel and Oak Creek as well. And there's somebody at the West Bend and then community memorial hospitals too. And they could give you samples if you were interested in that. But these are some of the ones we have at our Wauwatosa office. This is a really nice one, and it's a relatively new product in the last couple of years. And it's called Enter Complete. So I like this for people that are actively losing weight and really struggling with getting enough calories by regular food. And the reason I like this one is because it's 350 calories and 30 grams of protein. So it can give you both calories and protein, which is not every protein shake does that. Some of them instead will focus on one or the other. This is one of those. This is called Enter Max. This one is nice if people have difficulty with blood sugar control. and maybe more suitable for somebody whose focus is not as much stabilizing their weight as it is just having a snack option or some extra protein. This one has 150 calories and 30 grams of protein. You can see it's much less in carbs. It's 6 grams. So if someone was on insulin, they could use this one as a snack. Yes, and the concept, those look sugary. Yeah, that's a really complicated topic. And if you want to ask any other questions about the sugar content, we can definitely talk about that too. They are more sugary than some of the other options. And whether that's appropriate varies really from person to person. So that's where having a conversation with a dietitian can be helpful. And then somebody asked, is Premier Protein okay to drink? And that one's great. Yep, I just don't have samples of it, and it's a low sugar option. It's just not as high in calories. This one's called Enter Clear. Some people find the milky ones to not fit their taste buds. This one is also really sugary, but it's just another option out there for somebody that's maybe more into something real thin. It's just a little bit easier to get down, but it is only 180 calories and 8 grams of protein. But if you needed to do a low fat diet, like after surgery or something, these are also good options. Ensure Max and Clear. The next one I have is Orgain. So this is going to be a plant-based protein powder. So this is nice for somebody that's perhaps vegan. This is also nice because it's a powder. So you could make your own type of a protein shake, which sometimes is more pleasing to people's taste buds. There's a lot of protein powders out there. That's just the only one I have a sample of. Then the last one I wanted to point out is called Benecalorie. This one's only online. Most of the other ones are sold in some stores or you can get them online. But this is, I can show you, it looks like a little applesauce dish. They call this a food enhancer, and it's basically just a gel. It does contain milk protein, but the point of it is that it's really helpful for people that fill up very quickly. So you could add a calorie to a smoothie, you could add it to oatmeal, you could add it to pudding, applesauce, and it has 330 calories just in this little packet. So that's nice for somebody whose appetite's really, really struggling. And it's not flavored. So if the flavors of some of these are off-putting, then that one's nice. Well, other things I want to say, the Boost very high calorie. I don't have a sample, but it's on this slide. That one's also really impactful for people going through the heart of treatment and struggling with fullness or poor intake, because that one has 530 calories. So that can be really helpful. Our pharmacy sells that one, or they also sell it online, not in stores. The only other one I want to point out is just the homemade smoothies. We have a lot of recipes. Some of them are 600 calories, which is more than any of these commercial varieties. And so that can be helpful if somebody really is having weight loss and could use an extra boost. And someone asked about the Owen plant-based, and that's also a really nice one. They just don't give us samples, but it's really any of the brands are good, but if you need more, if you're trying to gain weight, I would say going for a 300 calorie option or more, or putting the Owen into like a blender and adding peanut butter or something like that to it. And then the other question a couple other questions I'm going to address those at the end because they go outside of the smoothies. The homemade smoothie recipe you can email me for, or you can ask your doctor for dietitian visit. Okay. Oops, sorry. Okay. So taste changes. I mentioned that this one is really common during treatment, especially chemotherapy. It could be a chemotherapy side effect. Sometimes it could be caused by medications, though, as well. So that could be if it's not resolving after chemotherapy, you could ask your doctor to have the pharmacist look over your medications and see if any of the side effects are taste changes. And then a less common side reason for taste changes as a side effect would be zinc deficiency. The people most at risk for this being the cause would be people who have been having a lot of diarrhea, as that's associated with zinc losses too. There's a lot of different tips for managing taste changes. One of them is a baking soda mouth rinse. The recipe's on this little page. And then using really sharp flavors as well. Vinegar, lemon, tart cherries, those are often the things that come out for people with taste changes. But it kind of depends on what is going on with the taste changes. So if you're having heightened saltiness, there's certain recommendations for that versus sweet. So if you are having this, I would actually recommend you do ask your doctor for a dietitian visit, and we can get more in depth on the topic. Okay, so then for GI issues, you could experience constipation, and then more often with pancreas, you may experience diarrhea. So we'll just briefly start by talking about constipation, which could be caused by pain medication. That's a super common cause. Sometimes chemotherapy, not having enough fiber in the diet, and then perhaps by taking too many pancreatic enzymes. So if it's caused by pain meds, you can take more fiber-rich foods slowly as a chemotherapy. Really, actually, any of these causes, you could do any of these management tips. So increasing fiber-rich foods, that would be things like nuts, seeds, beans, raw fruits and vegetables, as long as your doctor's okay with it. Occasionally, somebody is not appropriate to be having fiber-rich foods, specifically if they have a duodenal stent, if they've had other medical history, if they're late in radiation, they shouldn't have more fiber-rich foods. But generally, as long as your doctor's fine with it, increasing those foods will help to pass your bowels. Increasing your hydration and your activity are very helpful for constipation. Avoiding foods that bulk your bowel movements, like bananas. And then, if needed, using a stool softener or laxative, which your doctor could help with. The flip side, if you're having too many bowel movements, will tell you kind of the opposite as far as diet goes. So if you're having diarrhea, we may tell you to increase your pancreatic enzymes. And then we may also tell you to decrease how much fiber you're having. So limit nuts, seeds, beans, raw fruits and vegetables, and so on. There could also be some dairy component as well. During any point in your treatment, someone could get a temporary lactose intolerance. So that'd be something to keep in mind. And then if you need it, your doctor could work with you on taking Imodium or Lamodal, which are two medication agents. Imodium is over the counter, Lamodal is prescription. And then soluble fiber like Metamucil and Benefiber. If you are having a lot of diarrhea and want to talk about it more, we have a few really nice handouts that we could give. We could give you a little picture of it's on this page. But hydration is important across the board, as is activity, but there's a lot of diet recommendations. What I talked about is kind of just a broad overview. So with pancreatic surgery, dietitians work with pretty much every single patient who gets a Whipple, a distal pancreatectomy, or a total pancreatectomy at Froedtert. A lot of reasons for that, but basically we know that good nutrition leading up to the surgery is associated with faster healing, better outcomes and just getting you back to normal faster, which is, of course, our goal for everybody. So with the surgery, we want to help you maintain the weight. The surgeries themselves are often associated with some degree of weight loss and often some degree of altered GI patterns. So we do have people limit fat and fiber for a couple weeks after surgery, as those foods can make any GI issues worse, like it could make diarrhea or gas or bloating worse. Some of these patients are on nutrition support as well, which frankly could be a whole nother presentation, but those are IV nutrition or being fed through a tube if somebody really needed some extra boost in nutrition. And then also importantly, making sure people are getting enough hydration to help them getting over the hump of surgery. We all also are monitoring the need for insulin. That's especially with the help of the diabetes team, and then pancreatic enzymes. So the dietitians here do a lot of counseling with patients on adjusting how much of those enzymes you would need after surgery. Often the amount of enzymes someone needs after surgery is different than before surgery. So this slide is just talking about different current topics with pancreatic cancer, cancer in general, vitamin and mineral supplementation. This would mostly be for people after surgery. They may be at risk for some certain vitamin deficiencies, especially if they're having a lot of diarrhea. So that would be something to ask the doctor about, checking your labs if you are one of those individuals, or if you've been really struggling with poor intake. A ketogenic diet is, I know, on a lot of message boards and that type of thing. So we are kind of still in the infancy of research surrounding the ketogenic diet and pancreas cancer and cancer in general. Most of the research has been done on mice so far, and the outcomes are not bad, but it's really difficult to mimic in the human population because it is a really hard diet to follow. And over time, maybe in 5-10 years, we'll have a better understanding on how this impacts people. But basically, there are theories that following a ketogenic diet could help with people basically tolerating the treatment better. And then there's different thoughts around limiting sugar, that amount as well. But we'll see over time where that theory lands. The same goes for intermittent fasting. There's thoughts that keeping your intake down before you go into chemotherapy could be helpful for tolerating chemo, but same, the research is very new. And we always need to keep in mind with both of these diets how the person is doing in general, because we know that keto and intermittent fasting are often associated with weight loss for the general population. Like, other people sometimes use these diets to lose weight, and a lot of times our patients, that is something we really don't want for them, because we know that losing weight, malnutrition is associated with poorer muscle mass, harder time getting through treatment, and then sometimes poorer outcomes as a result. And so we always have to be really mindful of that. Some recipe resources. I love sharing one called cookforyourlife.org. This is a resource that they do have a weekly email blast, but they also just have a lot of great recipes on their website in general, for people who are in the survivorship phase, and also for people who are in treatment. So if you're someone that likes to cook, or have a family member with you that likes to cook, or is asking what they could make for you, this is a nice website to use, because if you're having diarrhea or taste changes or whatever it is, they have a whole section of the website that's recipes for this side effect or that side effect. So that's a nice place to look if you need more ideas. And then survivorship is a wonderful topic as well. There are nutrition topics surrounding survivorship that are different recommendations than for people in treatment. We have a whole booklet on this. We have a booklet on the ketogenic diet as well. So if you want more information on either of those, you're welcome to reach out. But just to summarize, proper nutrition, super important with pancreatic cancer and each phase of treatment and survivorship phase. Trying to prevent weight loss for the most part, unless you're recommended by your doctor to be trying to lose weight. And then really just being mindful of your side effects. I take it that most people already are doing a lot of these things and trying to be mindful if they're attending this, but just every step of your treatment, assessing how you're doing, how are your bowels, are you having any barriers to eating like nausea, so that you're basically just trying to optimize. This is me. Feel free to reach out if I can answer any questions or if you had any additional resources you were interested in. Well, let me just look through some of the questions. So somebody was saying they lost 35 pounds after the Whipple surgery and just can't seem to gain it back no matter how much they eat. Is there anything that they can do, or is this kind of a new baseline weight for them? That I have probably 10 other questions to go off of that. That could probably be a half an hour discussion. It depends on what your bowels are doing. That's really big. What your activity level is, how's your hydration. So I would say if you're not, haven't recently been in touch with a dietitian to do so then we could really go through in depth some of those considerations. And then I could try to pinpoint more what's going on for you, because that could have a lot of different answers accordingly. Will you be hosting another one of these Zooms? Not on nutrition, but I believe Dr. Erickson is coming up later this week with radiation for the November pancreas month.
Correct.
Where do we get?
Dr. Erickson will be here on Wednesday virtually.
Okay, great. And then where do we get the homemade smoothie recipes? If you would like to send me an email, I could send you them tomorrow. Otherwise, you can ask your doctor if you're afraid or patient to have a dietitian visit. They could give you a copy in person. And then next, my oncologist advised not to eat popcorn or corn as the pancreas does not digest the kernels. What other foods should be avoided and what foods produce excess gas? So those are going to be those high fiber foods. There was a slide that started to touch on that, but that's going to be your nuts, seeds. So that includes like fruit with seeds in it. Or skins. So like blueberries that has skin and seeds, those can be gassy. A lot of vegetables are gas producing, especially our cruciferous vegetables, which are things like broccoli, cabbage, kale, cauliflower. A lot of our whole grains, popcorn, as you mentioned. I'm surely missing some, but I have a nice handout on both gas and a low fiber diet that you are welcome to ask for. Then that way you can make sure we're not missing any of the foods. Can we get a copy of your slides and recording that Olive can touch on as well?
Yes, so all of these Zoom sessions, CJ's and Dr. So's, Dr. Evans, etc., all of them are recorded, and we will be sending out a blast email on where to find them after the month is over.
Great. These are great questions. What are your thoughts on oil? I was told oil feeds pancreatic cancer. Okay, so oil or any fat in general would be requiring more pancreatic enzymes to digest that oil. So I would just consider fat in general and pancreas to be associated because the pancreas produces those pancreatic enzymes. So I don't know if you're getting at just oil in general, but just generally speaking, the more olive oil, canola oil, that type of thing, you're going to need more pancreatic enzymes to digest that if you have that pancreatic insufficiency, which you can look at the slides or ask me for more details if needed. And then how about MCT oil? PanCan recommends this to help with calorie absorption. So that's the only type of oil compared to like olive oil, canola oil, etc., that bypasses the same way that other oils are digested. So MCT oil does not need pancreatic enzymes to digest. So for somebody who's having fat malabsorption and can't really get it under good control with enzymes, or just kind of needs an extra boost in their nutrition and whatnot, MCT oil can be really nice. I know some people add it to their coffees. You can work up to it though. So I would start with more like a teaspoon because it can be gassy if you just jump to the goal. I have to look online, so I won't say it's a tablespoon, but I can't remember how many times a day that they recommend. But yeah, I think that's really nice. Tips on eating specific foods moving towards a Whipple surgery. Could be a pretty lengthy topic as well, but broadly speaking, eating on a meal schedule, meaning not skipping meals, having protein every time that you eat. That's for strength and muscle mass. Good activity, good hydration, monitoring your weight at home at least a couple of times a week to make sure that your weight isn't taking a nosedive before surgery. Because again, if you can just optimize and maintain general good nutrition, that's going to help you with healing. Do you recommend simethicone in addition to Creon? Maybe it depends. Creon in and of itself really should help somebody with gas. So if the reason you're having gas is because of fat malabsorption, the Creon should help. If it's not, it may be a sign that you need more Creon and need more information in order to know that. So again, opening the capsules can be helpful though as well. But yeah, usually it doesn't hurt. I would just cross-check with your doctor. And then how do you know if you have fat malabsorption? That would be if you're having bowel movements that are often more than twice a day, floating, tan, oily, a lot of gas and odor. It seems that I have dumping syndrome after a Whipple, symptoms of hypoglycemia after meals. I should avoid simple sugars. Any other advice? Yes, that's a less common issue associated with the Whipple, but occasionally people will notice that they eat a lot of simple sugar, meaning like juice or cakes, that type of thing, and then they have basically have bowel movements right after sugar. Um, oh, so yeah, I would actually talk more with your doctor and have a dietitian on that. And then if you're having hypoglycemia symptoms after meals, a diabetes team. But yeah, maybe you should avoid simple sugars, but that's a little complicated if you're having low blood sugars too. Oh, and can you recommend a specific MCT oil brand? Let me just double check here. If you're a Froedtert patient, usually the Froedtert Cancer Center does sell MCT oil right at the pharmacy here. I don't actually have a specific brand that I recommend. So no, for ease, I would just get the one that's at the pharmacy. But otherwise, you could go to like a GNC type store and they would have that here. Any other questions? Otherwise, I think we're a couple minutes over the time, but those are all wonderful questions. So I appreciate you all talking
Excuse
through
me.
all of that. Yes.
Excuse me. Can I ask one more question, please?
Yes.
Yeah, I am a pancreatic cancer patient. I did the triplet and then 33 days of radiation.
Mhm.
I have not had my pancreas removed, and I'm having to take, in order to stabilize my constipation, 3 Senecot S in the morning, 3 Senecot S in the evening, to make sure that I don't end up in the emergency room again. Would
Yeah.
Creon, I've never taken Creon. I can pretty much eat what I wish. Would Creon help that problem with constipation?
So it might make the constipation worse.
Oh, I don't
Yeah.
want that.
So taking the side effect of taking too much Creon would be constipation. So um, I think the medications you're taking sound appropriate. Hydration, it's kind of basic. Or your doctor can always add on other medications as well. There's a
Thank you.
nice product called Smooth Move Tea out there as well. It's a tea that is near all the other teas in the grocery aisle, but it contains the senna plant derivative. So some people find it's just a nice natural way. And any hot drinks in general, like coffee is under that umbrella too, can help to stimulate the bowel movements. So it's just another idea that's nutrition specific. Then for you, making sure you are getting fiber in your diet, unless your doctor doesn't want that for some reason, but that would be like eating nuts and seeds and beans and raw vegetables and that type of thing. Does that answer your question?
Yes, thank you.
Okay, great. What other questions? I think I see someone trying to ask a question, but they might be muted. Give it another minute if anybody has a question. How soon after the Whipple should we meet with a dietitian? I'm assuming maybe some people on here from other facilities, which is wonderful. At Freighter, we meet with people before the Whipple surgery with your surgeon's pre-op visit. Same goes for if you're getting a total pancreatectomy. Then the dietitian meets with you when you're in the hospital. And then I see you again at your first post-op visit, usually your second as well. And then from there, if you continue, usually we see each other for a few visits and then kind of let you go after that if you're doing well. So for at Freighter, we usually see people within a week after their Whipple, but they've already gotten guidance beforehand. You're welcome. If you're from other facilities, one thing I'll say is that, including here, sometimes people don't know of the dietitian service, and it's generally not billed at most facilities. You'd have to check that. I don't know in other states as well, but it's a nice service, but you sometimes have to ask. I think that at Freighter, we're a little bit unique in that we staff these surgeon clinics who do the Whipple surgeries. So there's a lot of one-on-one dietitian counseling with that. And then same with the radiation. It's an automatic visit, but that's not necessarily true across all facilities. So it's always good to ask just in case you're not aware of the service. It may be available wherever you are. I do know that PanCan has a lot of nice nutrition resources as well. And then the Sina Megowitz Foundation too. Okay. Let's wait a little bit longer in case anyone else has a question. But I appreciate you all taking the time. I know a journey can be a lot, and please don't hesitate to contact if you have any specific questions. I know sometimes it's very detailed what you're going through, so don't hesitate to reach out. Happy to be a resource, and thank you, Olive, for hosting.
Yeah, thank you so much for your presentation. There's a lot of
You're
good
welcome.
information in there. Again, to everybody, these are all recorded. So at the end of the month, once we kind of have a home for all of these lectures, we will be sending out a mass email to where to find them, and Michelle's contact information will be on there. So please don't hesitate to reach out. She's very knowledgeable. But other than that, if anyone doesn't have any other questions, I think we are good to conclude this session. Thank you everybody so much for participating and asking all these great questions. Everybody have a great night. Thank you.
Thank you.